Are you one of those people that you're ruled by your stomach? Based on how your stomach feels is how the rest of your day goes. Can I go to the beach? Can I go to the party? Can I eat this? Can I not eat that? Am I going to feel sick? Oh my God, there's so many people that are like that. Well, we want to get to the bottom of that today. So, if you want to know more about that, just stay tuned. Hey, good morning, everyone, and welcome to Scan FYI. My guest today is Dr. Glenn Parker. Good morning, Dr. Parker.
Good morning, Andrea.
Thank you so much for being with me today. We're going to talk about some common problems that many seniors face. But before we even get to that, would you kindly just introduce yourself a little bit and tell everyone about what you do?
Sure, absolutely. Sometimes I refer to the seniors as adult young people.
Oh, I like it. Getting
Um,
younger all the
so
time.
I'm a colorectal surgeon, which means I take care of disorders relevant to the colon, the anal area, the rectum, and as we gain some years, as we usually describe it for our young people, unfortunately, our body does age. And just as our entire body may age, we have problems with our digestive system, our GI tract, some control sometimes. Most of the time, it's conversations you may not want to have with your friends, but certainly with a colon surgeon, this is how we may be able to help you with any disorder, how we may be able to prevent certain bad things from occurring as we get older.
Right.
And so that's the importance of seeking medical attention. One may be embarrassed, but never be embarrassed with your seeking your physician and healthcare. That's really important.
Yeah,
Um,
that is a good point. If you're not going to be honest with your doctor, what's the point of going to the doctor?
yes, and many times we delay symptoms. We have change in bowel habits. We have bloating. We have some incontinence, or we may have bleeding. And I think men more than women sometimes are just hesitant and attribute it to another cause. And I can't tell you how important it is to get evaluated and not neglect any symptoms. It's such a joy when it turns out to be nothing. And sometimes
That's
it's
true.
just some simple medication and easy to help people. And obviously, we take care of very complex problems as well. Um, And people are unfortunately concerned about the C word at times, meaning colon cancer or rectal cancer. And we have advanced so much. Some people say medicine hasn't changed very much, but we have advanced with treatments. And we talk about the potential. Obviously, prevention is always our goal, and we'll talk a little bit about colonoscopies during our discussion. And but cure is definitely a reality today, whether
Well,
it be
that's
with
that's
surgery.
a
I'm
C
sorry,
word we like, cure. We like that word.
100%. Um, but we need to, you need to let us get into the batter's box to help you take care of yourself. So
Right.
that's where the cure word becomes even more important, and not to neglect symptoms for 6 months or 9 months. And you can't say, well, I don't have time, and I can't make an appointment, or no one is there for me. So the important thing is, I think we're all here to help our patients and find out the best way to have an important outcome. I'm sorry if you hear crying. I have two babies in the house,
Oh, that's okay.
and I'm a grandpa. I'm old.
We're so let me a question because as I'm listening to you and I'm thinking to myself, so some of the things that you're describing, would you say that these are natural things that might happen as we age, as we get older, or do some people just seem to have lifelong issues that are only seem to be even worse as they get older?
Yes. I mean, there are certain people who have lifelong constipation. Um, we never want to attribute it, and we want to make sure that they have appropriate workup. But as we get old, just like our entire body changes, our heart, our brain, our gut changes as well. And it's even more important to maintain our gut health. Most people have heard of the microbiome, and that just refers to what is the normal bacteria in our gut and how can we maintain that.
So
And
what would you
yeah.
say are, oh, I'm sorry, go ahead.
Oh, go ahead. Go ahead.
What would you say are the most common things that people face, especially as we're getting younger, older, or older, younger?
Um, I
I
think
like that.
constipation is probably occurs in about 30% of individuals. We become somewhat sedentary, meaning we're not very active. Exercise is a very important component to maintain our body health overall. We hesitate and don't drink enough fluids. Now, some people have cardiac issues or renal issues, and they're not allowed to drink a lot of fluids, but it is important to drink 6 to 8 glasses of liquid a day, maintain your hydration, especially during the summer season. We've just
Right.
went through extremely difficult
Hmm.
heat wave,
Yes.
um, and we never drink enough liquids, and that is really a vital component. Um, and I don't want to make this too complicated, but there's all sorts of issues with drinking from plastic containers, and you should drink from whether you should drink from cans. And now it's gotten even more complicated. Club soda is a problem. Um, try to stay away from sugary beverages. I think is pretty important overall for as we age, we may develop diabetes, which could be related to diet as well. Um, so that's an important component. Minimize
So,
sugar drinks, hydrate well, exercise, and then we can talk about maintaining our gut health by having fiber. You can
right.
do that through dietary means or fiber supplements, and you, excuse me. So men and women need 20 to 30 grams of fiber a day. Again, you can get that through diet. Um, and that may help with some of the, sorry, um, that may help with your gut health and your constipation as well. So when you have issues with your GI tract, I picked on constipation, but you could also have reflux symptomatology. You could have diarrhea.
Hmm.
You could have trouble swallowing. You could have fecal incontinence, meaning unfortunately, as we age, the rectum or the muscles down there don't work as well. Could be based on some problem you had from the past that is now becoming a bigger problem. And again, there are ways to help. I mean, everybody wants non-invasive, non-surgical means,
Of
and
course we do.
certainly that is our first goal always. Um, the next goal when I see a patient is to identify what their problem is. I think it's imperative to listen to the patient. Patients always come to me, I have hemorrhoids. Okay, maybe. But it's important that we listen to the patient, come in, examine the patient, and try to figure out where they are in their life with their particular problem, and then we try to assess, how serious it is, and then we escalate from there. Whether it be testing, one of my favorite tests is a CAT scan, gives me a host of information um, for specifically talking about the colon, evaluating the colon, which I'll talk about a couple different means because I want to talk about non-invasive first.
Right.
Um, then we can talk about some examinations of the colon, um, which may be embarrassing, but a necessary evil to have done. Um, so when we talk about as we age, it's important to have your colon evaluated. Now, we'll talk about the easier tests. Um, and then I'll talk about the little more invasive tests.
Right.
But basically, the guidelines to get a colonoscopy, they have lowered the age when to have an evaluation of your colon. So the GI standard is to get a colonoscopy by the age of 45. Now, if you have a family history, that makes it a little bit more pressing that you get an evaluation
Yes.
earlier. It could be at 30, it could be at 20, depending on when the individual in the family developed that unfortunate colon cancer or rectal cancer. So anybody who has a strong family history, one relative, two relatives, first degree relative, meaning brother, uh, sister, mother, father, those would be considered first degree relatives. When we talk about grandparents, they're considered second degree relatives. Um, Not as relevant with we call them guidelines. And that's exactly what they are. They're just guidelines. So seeking a physician's help and trying to figure out what fits for the individual is perfect. I'm sure everyone's seen if you have TV, the white and blue box that kind of walks around and says, "Hi, I'm Cologuard." Um,
Right. Right.
the commercials are great. It's quite comical. The nice thing about Cologuard, it's detects DNA within the stool. You don't have to have any preparation, meaning cleaning yourself out, because
Hmm.
that is the dreaded thing that patients don't really want to undergo.
Right.
Uh,
That's the
and
dreaded part. Yeah.
right, that is a dreaded part, and we'll talk about that um, as well. But the Cologuard is a DNA test. It takes a look at the stool. You get a kit. It's ordered by your physician. Now, unfortunately, Cologuard, I don't believe they will pay for above the age of 80. So the octogenarians and nonagenarians, and as the population ages and are, having a better lifestyle, doing better things for themselves and helping themselves, um, then that may help them dramatically.
Is that just when you get the results from Cologuard, if I'm saying it correctly, is that just as effective? Do you feel like that is a
It's a,
gold
it's a,
standard?
that's a great question. Definitely not the gold standard. We call it scientific literature, it's about 80 to 90% sensitive, meaning it could be a false negative test, meaning the
Hmm.
test is negative and you could have something, unfortunately. Almost every test, there's a false negative, and then there's false positives, meaning you, have the test and, it turns out to be positive. And if the test is positive, that would trigger an indication to do what's called a colonoscopy.
Yes, of course, of course.
Yes.
Okay.
So that would be it's an acceptable non-invasive test. Some people have fear of anesthesia. Some people will not undergo the preparation or can't tolerate the prep. There's something like that. In my office, I do the same prep I give my patients. Um, Usually we mix Gatorade with Miralax. It's about 64 ounces. Um, some people say to me after they have that, they said, "Well, I'm never having Gatorade again." I said, "Okay, but you can mix it with Crystal Light, lemonade. Again, some of this stuff you would have to, if you're diabetic, you have to take the Gatorade, which is sugar free, or lemonade, sugar
Right.
free, and all these other things, or iced tea, or just water. Some people will have. So it's a flush out, it's a clean out the day before. Obviously, you have to stay close to the bathroom. I don't know if anybody saw the Larry David episode where Larry's wife she was doing a bowel prep, and for some reason she went to the car wash, and the car got stuck in the car wash, and she had to go. Quite a comical uh, scenario. But again, I tell people stay close to their bathroom. Don't kind of sit on your couch, and because if you have to go, you may have some lack of control, and it's very unpleasant. So get a good book, sit on the toilet too long, uh, and just go. So the nice thing about colonoscopy is, for the most part, you get sedation, and sedation is done by an anesthesiologist, which has changed dramatically over my career. Um, and the anesthesiologists give medication, which works quick, wears off quick. and doesn't really change your vitals too much. And you're monitored by a board certified individual who's very
Mm-hmm.
capable. I mean, yesterday I did 9 colonoscopies. Thank God completed. Thank God all successful.
One day,
And
yeah.
so it's quite a nice event. Colonoscopies take roughly 15 to 20 minutes to actually do the procedure, and the patients wake up fresh. And the equipment is amazing. We have a video monitor. We used to use air, which blew up patients a little too much. So um, our audience may have seen patients who said, "Well, I woke up in a lot of pain." We use carbon dioxide, which is rapidly absorbed. I don't want to get too complicated, but patients wake up, they're like, "Oh, wow, are you done? That's great."
Okay.
Obviously, barring any untoward events that occur during colonoscopy, which are exceedingly rare, exceedingly rare. Complication rate is less than 1%.
So here's a question about a colonoscopy specifically. So is there an age limit when you would say, yeah, you don't have to do this anymore?
It's a good question. So the guidelines for not someone who has a family history is
Right, if you
repeat
don't have a family history.
colonoscopy today, normal, like yesterday. And I had the exact question from a patient who is 76. His colonoscopy was normal and may have had some pockets in the colon called diverticula, which I tell them to watch out for so they don't get infection or inflammation of that.
Mhm.
Um, which is something unfortunately we treat quite frequently. And so I booked him. I told him we'll repeat it in 5 years. Is that a little aggressive? So I look at the patient, I reevaluate them in 5 years. I want to make sure that their symptoms are okay because although the guidelines may speak to about 10 years, I'm a little more conservative and I want to reevaluate my patients because nothing that we do to patients is perfect. And so we want to make sure that, I mean, could they have come in and have some bleeding or change in bowel habits or something new that had occurred? There are benign conditions that can occur in the colon, which are not polyps. Like I said, diverticular disease. It's
Right.
not always. It's not always about that. We do colonoscopy for a variety of assessments of what's going on in the patient's colon. They could have inflammation. They could have antibiotic colitis. And, I don't want to get too complicated, but there are lots of indications to repeat a colonoscopy. So one of the things I tell my patients is, if you have a problem, if you have symptoms, if you have bleeding, don't say, well, I had a colonoscopy 3 years ago. Life is perfect. At least get reevaluated by the physician. So that's why I'm not, a lot of people say, well, I'll see you in 10 years. I'm just a little bit much more conservative. Now, when you
Okay.
talk about above the age of 80, again, we'll talk about some, I don't want to say let's just call them less invasive testing of the colon to be evaluated. I think that's important. And but let me just finish with colonoscopy. I assess the patient. So if the patient walks into my office and they're completely healthy and there are no issues, um, colon cancer is much more prevalent in that age group. So could something have occurred just from the surface? I mean, we talk about cancer arising from polyps and maintaining a sequence of growing and changing how the configuration of the polyp is. Sometimes they can arise from the surface. Rare,
Mm-hmm.
but there is a component of patients that have that. Not to scare anybody, but that's why I think reassessment, talking to the patient, seeing how they are, 5 years in my mind is a short time, but a long time. So,
Yes, I
um, some patients have booked colonoscopies, and then 6 months later they come back to me. They didn't get it done, and so I want to see them. And it turns out in the middle they had open heart surgery. Okay, well that's pretty important to know. Some of the patients don't think anything of it, but again, complete history and physical, making sure that they're okay before we are doing anything invasive. So in my mind, have I ever done a colonoscopy on somebody 90? I've done colon resections on people who are 100. Now,
okay.
patient and did they do well? Yes. I mean, so in my mind, although it's chronologically a little bit older, if somebody has a blockage or an obstruction, In that patient, the 100-year-old never had a colonoscopy. She ended up having 2 colon cancers, 2 resections, and she did fine.
Wow. Well, good for
She
her.
was she was unfortunately in the hospital for her 100th birthday, but that was all.
But she lived to talk about it, which is the
And,
good
and
thing.
these may seem anecdotal, but we have more success stories.
So
The
you
group of
want to mention in the last thing that we'll have time for, you want to mention something about more non-invasive ways of checking you out?
Yes, there is some amazing testing. Science have advanced. There is a special CAT scan called virtual colonoscopy or CT colonography, which is a way that, so I have patients certain times that have certain diseases. I can't visualize a whole colon. So we can send them for this test. And above the age of 65, we could send it and they don't even have to have a colonoscopy. So it's a 3-way evaluation of the colon. It's a reconstruction of the colon. It's actually sort of like a colonoscopy. You can actually visualize. This is all radiologic testing, and
Wow.
it's a CAT scan of the whole abdomen. So it's an amazing test. I love it for those patients. Sometimes I can't complete their colonoscopy for a variety of reasons. And sometimes we'll go right to that test depending on what's going on with that individual. It takes about, I think, about a half an hour. You do have to clean out. That's another problem with it. It is a vigorous clean out. Patients are awake for the test, which that part they don't like. So they're undergoing a test, and the reason they're awake is because they have to lie in their stomach and they have to lie on their back to get all the
Right.
different images to interpret what's going on to give you a clean bill of health. The older test was a barium enema, which is barium was inserted into the rectum. And for the most part, we've replaced that with something called the gastrographin enema, which is just a substance, and that's inserted into the rectum and by a tech or the radiologist, and it outlines the entire colon. With a virtual colonoscopy, they use air only.
Interesting. So
So,
there,
and again, this would
there's
require.
many options out there. I think that's most people probably are absolutely not aware of this, that there are many options. And obviously, another reason to see your doctor because you know this. We don't know this. Yeah.
Yes, and I can't tell you the surprise on patients' face, and I do try to pick and choose what is the appropriate test. It's not just, oh, you need a colonoscopy and that's all. I have a conversation. I see what their symptoms are. Sometimes I'll do a CAT scan beforehand to figure out
Right.
what's going on. Or sometimes people come to me with a CAT scan that shows something going on in the colon, and I say, well, I can't get through that colon with a colonoscope, and this is another alternative.
All right. Well, Dr. Parker, I'm so grateful that you took the time to, share this with our audience. And I do want to remind everyone out there that Dr. Parker is with Atlantic Surgical Group. I'll put all the info in the show notes. Should you suddenly, I feel like you'll be flooded with appointments, Dr. Parker. I don't know if that's good or bad. Oh, I shouldn't have said flooding because we did have a big flood. Sorry about that. Sorry about that.
That was a
Yeah.
good one.
All right. Well, again, thank you so much for being my guest today. Much
My
appreciation.
pleasure. Thank you for your time.
And remember out
I
there,
had quite some fun.
if it's important to you, it's important to us. I'm Andrea Tarr, and we'll see you next time on Scan FYI. Bye, everyone. Bye, Dr. Parker.